Good afternoon. Welcome back to Monday Motivation with my good friend, Dr. Serena H. Chen, a colleague of mine from IRMS in Livingston, New Jersey. I'm Alice Crisci, co-founder and CEO of MetaAnswers, creator of the Fertility Answers app platform. Now, there's seemingly nothing else going on in the world right now beyond coronavirus. We know this, right? It has become pretty difficult to go about life as usual when never in our lifetimes, I don't think, Serena, have you or I ever seen whole cities in different countries locked down. I mean, we've seen containment for Ebola. We've seen containment, we've seen pregnant women leave cities to protect pregnancies from Zika. We've never witnessed something like this before.
So, I hate to say never, but I remember vaguely SARS and MERS, and it didn't really come over here, right?
It
So it
didn't.
wasn't
Yeah, we felt
really,
so protected.
yeah, it seemed like some big news far away, and now people are really feeling it here, although there's a lot of reassuring data in the United States, despite the fact that they are identifying more cases and they are doing more travel restrictions. I think there's still a lot of things that are reassuring about the situation in the United States. Now, I don't want to belittle what's going on at all, but I do think it is important to remember that healthy people, pregnant women, and children do not appear to be susceptible to getting a severe case of the virus. It looks like the deaths so far in the United States and have been people who are already very, very, very vulnerable to viruses anyway, which are the elderly with something we like to call comorbidities, which usually is
Right.
stuff like you already have a chronic lung disease, you already
Like
have that
COPD
COPD,
or
right?
some,
Lung
or,
cancer,
exactly.
you're on chemotherapy, you
Right.
have heart failure. So really, if you have a serious underlying illness, it does increase your risk of death, honestly, from any infection, and coronavirus is no exception to that.
Now,
But
it does look
unlike,
like your level of exposure though makes a difference too, because we do have healthy first responders who have succumbed to coronavirus. That seems to be more related, no underlying health conditions, to the level of exposure. When
massive
they've been
inoculation,
yes,
yes, massive
exactly.
inoculation.
Which
And
no average person would ever have that level of inoculation. Certainly not with whole festivals like South by Southwest being canceled. And those
right.
really big public environments where you could have just extreme amounts of
Right.
viral kind of passage from person to person. Now, I also was reading that that people aren't really showing symptoms until about 5 days after they've been exposed, is
Right,
what I
but
read
I think a
recently.
lot of people get really crazy about that because they're just thinking everybody around them has cooties and they're going to get it. But the
Exactly.
thing is, when you're asymptomatic, you're not really shedding as much.
Yeah,
Okay,
right.
remember, this virus can only attach to respiratory epithelium, which people get confused about. People think it's in the air and they're going to breathe it and then they're going to get sick. But what happens is when people cough or sneeze, if they're ill or they're shedding virus, the virus can live on surfaces for about a week. And we are touching surfaces all the
All the
time.
time.
And then we are touching our faces, and the ports of entry are the mouth, the nose, and the eyes, because the mucous membranes in the eyes are attached to the nose and eventually lead to the oropharynx. So this goes back to biology, how everything's connected there. So those are the ports of entry. That's how the virus gets to the respiratory epithelium. It doesn't go through your skin. You can't really breathe like somebody who's in another room, and then if you breathe the same air, it's not airborne.
Right.
Not
It's
airborne.
literally just leave your face alone. That's why washing your hands, makes such is the most important thing, and hand sanitizers out, but they say soap and water for 20 seconds is better
Honestly,
anyway.
soap and water is really the number one best way to sanitize your hands. Hand sanitizer is only helpful if you don't have good, easy access to a sink,
Sure.
right?
Right.
It's soap,
Right.
soap. And we're seeing these crazy things where people are like just buying out all the hand sanitizer. Meanwhile, there's tons of soap in the stores.
Yes.
So
Right.
it doesn't totally make sense. And this run in the grocery stores maybe is because the CDC told people at risk that they should be prepared to stay home. So if you have severe heart disease, the CDC doesn't want you going out. They want you to have
Of course.
your healthy relative or your healthy friend go to the grocery store for you instead of you going out. So there is some advice on the CDC website about making sure you have supplies to be able to stay at home if you are vulnerable to coronavirus, but not
Yeah.
really for people who are healthy. Okay.
Right.
So
Right.
this run on the grocery stores doesn't really make medical sense.
That I understand. However, if we have one of the cities, just like Italy or some of these other areas where things really, they're closing schools in Seattle, they're closing colleges. And if you are on quote unquote lockdown, which is a terrible term, because it's so alarming. But if you are, then you need to have enough supplies to take care of yourself, to eat, to bathe, to wipe your tushy.
Yeah, that's
These
true.
things I think those things are the things that we haven't ever really been a part of before outside of hurricane preparation, earthquake prep, blizzards. And you're only talking about a few days in those types of scenarios. You're not talking about, nobody ever anticipated Katrina, ever, ever, ever. Right.
Right.
But,
But I'm not
not in
sure
the US.
it's like I'm
So,
not sure that we're necessarily looking at like a house arrest, necessarily. Because I feel like, if you're staying away from sick people, if you're maintaining distances between people, there's this guideline, 6 feet, you
which you
six stay
can't do in
six
a college classroom.
right, which you can't do in a
You
college
cannot do,
classroom.
or in an
But
elementary school classroom.
it doesn't necessarily mean that that you're on house arrest. It's not, you know what I'm saying? It's not necessarily the same thing.
I get that, but that
Yeah.
is what happened in Wuhan. That is what's
Yeah.
happening in,
Right.
in whole cities. I mean, 16 million people in Italy now are in lockdown. So I think that it's wise to be prepared for, not being able to leave your house, even in case your whole entire family, starts coming down with the virus, and you end up with 4 weeks where it takes everybody to get through it. The thing that I wanted to really cover today is more the impact that panic has on decision making.
Right.
Because in our world in fertility, we're surprised. I was surprised anyway to hear that more people are now contacting clinics to ask about fertility preservation out of sort of this fear of the unknown. And if we're facing, an 8-week period, where we're expecting the worst of the virus to kind of happen and then fade out because of heat and not being, and I know I'm not saying the technical terms correctly, but my point is I'm sort of surprised that this external factor would have people start to reconsider, is now the right time for me to do fertility preservation?
Well, we haven't seen that, Alice. I think that is an interesting idea, and it's always hard to know how these kinds of things impact people on a personal level and affect their personal decision making. But we actually have not seen that. We still met a couple of people say, "Oh, I just got back from Italy. You probably
Mm-hmm.
don't want me to come in." And we say, "Yes, we're going to do a Skype consult. And when the 2 weeks is up, then don't worry. You'll come in for your exam and your sonogram, all those kinds of things."
Great.
But we haven't really seen like a panic. Well, I want to change all my plans. I suddenly want to do egg freezing. We actually have not seen that. And I've been asking around. We haven't necessarily seen that everywhere. I know there was a story in the New York Post, but I haven't really heard that from a lot of other programs. Have you been hearing it from around the country, or?
I've only heard it from one place, but it was
Yeah.
enough where I went, I had not considered that might be a byproduct of this. People kind of
Right.
racing, because most people are like, should I even come in? Should I
Right.
maybe delay? it's more hesitation. Is this really the right
That's what
time?
that's what that's what we're seeing. Although not so much. I think
Yeah,
patients that are really focused on having a baby and having a
exactly.
plan really, they really just want to move forward. They want to be safe, but they'd like to move forward, and they're looking for ways to be able to do that. So
Exactly.
we haven't seen a lot of that. Now, on the other hand, we've been taking a tremendous number of precautions for ourselves and for our employees, not because we think we're at high risk of death or anything like that, because as we said, we feel like the vast majority of people who will get the coronavirus will not have very little in the way of symptoms, more like mild cold symptoms,
Right.
and a much smaller minority will actually have
Hmm.
serious symptoms where they might need to go to the hospital, and a very, very, very small percentage are actually at risk of dying. So we're not really concerned about our patients or our staff getting severely ill, but obviously we don't want to spread things. We want to help contain. We want to be responsible.
Absolutely. Nobody wants to be patient zero. I mean,
Right.
nobody wants that. Yes,
Yeah.
exactly. And I
And
think that, most of the
unlike a lot
time,
of other people, we can't telecommute for everything. So we do want our patients to
exactly.
know that,
You're there.
follow-up consults can all
Yes.
be done by the phone or by
Yes.
Skype. That or teleconference conferencing, that's not a big deal. But obviously, I have to be with you for your egg
Yes.
retrieval.
Yes.
So
Yeah.
that's what we're
You
doing right now.
cannot telecommute that yet.
Yes,
There is
not yet.
definitely not a catheter that is long enough to telecommute for your egg retrieval. This is true. I also think historically, people who are healthy enough to go through a fertility treatment, generally are not in the high risk category,
No, they're definitely not.
for
We just
exposure.
exactly, exactly.
Yeah.
That's just not the group that we're seeing. So
Right. Now,
yeah,
I think also historically, when it comes to fertility preservation and egg freezing, the people who make the quickest decision are the ones who are facing a crisis. Like in my case, when I was diagnosed with cancer, I was facing a very active and real, situation
imminent.
where
Yes,
imminent. My 8 week window, to when I was going to have surgery meant, I had one chance at fertility preservation. There's a lot of stuff to fit in that timetable. And other cases, military deployment is an imminent,
yes.
activity. I think that, or imminent event. I think that the struggle that so many people have with decision making is the holding out hope. Well, I still have time. If I don't do it this year, like I'll give myself another year.
Right.
Or they feel like they have maybe a 5 year window, maybe even a 10 year window. I think that a lot of women are thinking about this, and it is difficult to counsel them on when.
Well, this is why we have med answers, right? Is to
Hmm.
try to get as much information to people as possible, as directed as possible, as personal as possible, without actually having the visit, because you and I really, really feel like there's a big gap between what people are thinking and wondering about and the information
Exactly.
that they should be getting. And we cannot emphasize enough that it's never too early to get informed, to get educated.
That's
Maybe
right.
you do have 5 to 10 years, but how do you know that unless you really talk to a professional, unless you talk to an expert?
Mhm.
Like if you
Mhm.
assume that and you wait 5 years and you find out you were wrong, that's what we don't want. We don't want you to have regrets. We don't want to push you to do anything
Mhm.
you don't want to do. But being informed, there's no risk to being
That's
informed.
right. Mhm.
So
And I think for
that's
everybody it's a little bit different. I mean, the thing that I always advocate for is the best time to do fertility preservation is when you is way before you'd have to do 3 or 4 cycles
right.
to have any level of sort of comfort about your numbers, right?
Right.
And so if you're 30 and you have, 15 follicles on each side, like perfect. That's
Yeah.
what we want to see, because we don't want you to have to go through multiple cycles, right? To do
Right.
it.
Exactly. And you are talking about like our favorite graph here, and
Oh, I
maybe
love
we
it.
can
We have
maybe we
visual.
can include this
Yeah.
on your
Yeah,
links.
absolutely.
Is
We
this
can.
graph? It shows a bunch of different lines. Each line represents a different age, and it's obviously not telling you what you can expect, but it takes a whole population of data
That's
and
incredible.
gives an estimate of how many eggs we think it takes to make a baby. You shouldn't, this is not a substitute for a physician consult, but it shows
It's
quite
information.
dramatically that that age really does make a difference. Even though you're healthy, we want you to be as healthy as you can be. That is a good thing, but age, there still is a biological clock.
There just is. No matter how well you take care of yourself, no matter how many years you've done every single thing right,
Yes,
your ovaries don't care.
yeah.
I'm sorry about
Keep
that. I wish they
marching. They just
did.
keep
They
marching.
just
Yes.
do. They have no sense of how much broccoli you've eaten or how much exercise you've gotten. They just don't.
Yeah.
They are completely unaffected by all of it. I mean, at least the data that we currently have. I mean, we hope that they're impacted by omega-3s and this and that. But the harsh reality is that age does not, the biological clock does not stop for them, and it doesn't get slowed down either. It just doesn't. So I get, my heart breaks every time I hear somebody say, but I take such great care of myself, or I'm super healthy. So I'm heading into this, with hope, and I think, and I say, well, I want you to have all the facts. I want you to have eyes wide open. You could be the anomaly.
But we're not saying to panic. We're just saying
not at all.
Some information.
Exactly.
You might want to, you might not need fertility treatment. A lot of people don't need fertility treatment, even older women, but you don't really know unless you're evaluating it. I think it's just a good idea. And even if everything looks fine, this is your opportunity to try to have the healthiest pregnancy you can. I think even people who are not worried and don't have health risks and are not concerned about infertility, I still like the idea of preconception, like a year or two before you're thinking about having kids. Just ask your doctor, check things out. Like, just say
how to optimize now. Exactly. How do we get everything kind of in the best shape? And I think there's also this big question for people. And I spoke to a woman recently about it where she said, I don't really know that I want to ever have kids. I don't feel a strong desire to be a mom. But what I don't want is that if I fall in love someday and my spouse really wants to be a parent, I don't want my decisions to be the reason he can't be.
Right.
I thought that was
from a bunch of people. Yeah.
I thought that was a beautiful approach. I thought, gosh, I mean, that's somebody who could be, so open to the possibility. And I love that there's this idea of, well, I don't want to close off any possibilities for myself or for this other person. As of today, I'm not sure, but I'm not downplaying the fact that it is an invasive procedure, but it is 2 weeks out of one's life. Possibly like a month if you count kind of the prep work and then sort of coming off of, the retrieval. Sometimes, the fall of the hormones and a little bit of needing to recalibrate one's hormones before they feel sort of normalized again, but to have that choice. And for me, I was so unwilling to let cancer take away that choice for me that I would have done whatever it took. I would, and my oncologist would cringe at hearing me say this, but I would have delayed treatment. I absolutely would have. Yeah. That's how important it was for me to be a mom. And fortunately, I didn't need.
We usually don't have to delay treatment. Usually,
exactly.
As long as you get connected with the right person right away, you
can start rapid
delay treatment. And let it have any impact. And I think I'm seeing a tremendous number of women feeling like it's part of their being healthy plan, their being proactive plan. A lot of them have not made a decision about whether or not to have a family, but they're just feeling like, just like you said, they want to keep all their options open. And if that's something that their plan covers or that they can afford or that they even just only want to think about, I think that's great. And I think there are also a lot of, like, there are other ways to preserve your fertility besides just freezing your eggs. Like things like broccoli is good for you, but you're right, doesn't stop the biological clock. But we don't want to prematurely age our ovaries, and things like
smoking.
Right.
Exactly.
That's like
Please don't smoke. No matter what, please don't smoke.
It literally just kills off the eggs. Just kills them off. It's just
like chemo.
Like chemo.
Yeah. Exactly. So that's an important thing. I'm not suggesting that people shouldn't eat healthy. I'm just suggesting that it doesn't have quite the anti-aging impact that that all the antioxidants do. So it's all still really needed for healthy egg quality. But it's just not going to delay the aging like we wish it could. I think that's the holy grail of, what everybody would
People are
want.
working on it, though.
They
People
are working on it.
Yeah.
Yes.
Yeah.
Kate, we have somebody watching that asked a great question, which is what factors other than age should those hoping to preserve fertility consider? And we mentioned a couple so far. So we mentioned age. We mentioned, I think, family history of fertility trouble.
Family history of fertility trouble, especially premature ovarian failure, premature menopause, endometriosis, and polycystic ovarian syndrome. Those are huge. Any family history of Fragile X, history of BRCA positivity. So those are, and then any type of chronic medical condition that requires, delay of treatment or things like that. So they're like chemotherapy and radiation for cancer are the obvious ones, but some rheumatologic diseases require chemotherapy, like medications that could impact fertility. So those are all risk factors, I think. But honestly, I think sometimes people can't tell what their risk factors are. So I still feel like it's good to see a professional. It's good to see a doctor because, some people have no risk factors and yet might have below average ovarian reserve and might want to talk about that kind of counseling, so.
Yes, exactly. I still think it's about.
I think you can't have too much information.
I agree. And I still think that at the end of the day, it's about your relationship to choice and how many options you want for family planning in your future, whether definitively one way or the other, and how you feel about your partner, being really certain that they want to have a family, and then, you not having that as a possibility. I'm certainly at the age now where not making any more embryos, they're, if I even have, too many eggs left after having gone through chemo all those years ago, but, it's been 12 years, but I'm now 43, plus I've already been through chemo. I'm not going to be making any good normals, out of there, even if I did a cycle. I almost feel like doing it as an experiment to see, I told you they'd all be abnormal, but that kind of matters. Now, I've
Alice,
made choices.
I did want to bring something up because I feel like every time this discussion comes up, there are always a few people who say, like I feel really pressured. Like, why are you pressuring me? Why is everybody treating this like an emergency? You guys are alarmists. Like, what do you feel like is important to, let those people know?
Yeah, I think that is that was even the whole context of this, because I feel like a crisis happens and you are alarmed. Right. And I see mostly people not really knowing that when should I really pull the trigger on this, because they keep thinking, well, I can push this to next year. I can push this. I'm still young enough to push it to next year. It's more the opposite that I experience, but I would just say, breathe, first of all, that it's not an emergency. This is not alarming. In fact, if it does feel like it's an emergency or alarming, then maybe we should be having a conversation about single parenthood by choice.
Right.
Because if it really feels,
if you're feeling really, really pressured, maybe you and your practitioner are not necessarily a good fit, because
exactly, because it should never feel like you're being sold a medical treatment ever. It's really about sitting down and making sure that, and I think that sitting down with a reproductive psychologist is a great idea too. And there's, most practices across the country have them available, because they're so professionally trained to help people with the decision-making process, with living with regret, with living with, kind of that evaluation of, okay, I can't live with regret, but how do I make this choice? And how do I access the right resources? How do I save? I mean, there's all kinds of programs that I think that exist out there to help on that side. But I think that if anyone is feeling alarmed or pressured, that's a big red flag to me on a lot of levels. And so I agree with you that it's like, it might be a provider misfit, or Serena, I didn't see you just cough into the crook of your arm. I'm on Dante all the time, so we gotta practice.
Gosh, I know I've been doing this, but then somebody told me I shouldn't cough on my elbow, because then
God, where do we cough?
Oh my goodness!
Oh, now I don't even know where we're gonna cough.
It's a good thing I can't pass my germs through,
No, we're good.
it,
We're, exactly. Oh boy, we just had a perfect timing. Oh no, Joshua, we have a little moment with Serena's connectivity and her internet connection. Well, we'll wrap it up for the day. I mean, I think that the key is with decision making processes. There's so many great resources out there, for this. Our recommendation from Serena and I is, breathe through it, stay calm with the coronavirus madness. It's so critical to your health and wellness that you stay calm. And if that feels impossible, there's all kinds of meditation apps and there's all kinds of psychologists available. There's over 100,000 psychologists in the country, in the United States, that are licensed and available to be supportive. And when it comes to your decision making process for fertility preservation, finding somebody to help you really weigh through what do you value the most about having options for family planning in the future. What risks are you comfortable with taking, and then working through the timing issues. But I think outside of an event like cancer or a military deployment or another type of medical treatment that could lead to iatrogenic infertility, there is enough time to think through these things thoughtfully and really plan for your future. So on this Monday Motivation, as always, it's such a pleasure to be with you and with Dr. Chen. Thank you so much for joining us. We will see you next week, same time. And hopefully we don't have to talk about coronavirus next week. Thank you so much.